Hello, good morning.
Good morning.
I'm Dr. Naresh. I'm one of the specialists working in this hospital. I believe I'm speaking to Arthur.
Yes, doctor. Yes, I'm Arthur.
Arthur, how are you doing? How you like this posting?
Doctor, I'm really doing fine, and in fact, I enjoy working in pediatrics department a lot. And in fact, after working here with you all, I decided to choose pediatrics as one of my specialty.
That's really good. So I can see a budding pediatrician in the future.
Yeah,
Okay.
yeah.
So today I'm here to talk to you some you concerns you raised during the ward rounds, and I've seen you quite absorbing round. So is this okay with you? Let's go in the side room and sit and catch a cup of coffee, then we can discuss.
Yes, sure, doctor. Sure.
We can discuss all together.
Yes, yes.
Okay. So can you please let me know what exactly are your concerns to meet me today?
Doctor, yesterday I was posted in our department in the ward, and
Mm-hmm.
there was one uh, child named Samuel, 17-month-old,
Mm-hmm.
and he was admitted with fits.
Mm-hmm.
And then in the morning, he was discharged home when his mother kept on insisting that doctor, I think that a CT scan of his brain needs to be done, but our consultant decided that it is not needed. He told that it is just simple febrile seizures, so
Mm-hmm.
it is not indicated in that. So I'm not at all happy with the decision which our
Mm-hmm.
consultant took. So that's why I'm here to talk to you all about that.
Yeah. It's okay. Let's actually discuss all. How much do you know about the simple febrile convulsions?
Doctor, I just know that when fits occur in fever, we call it as febrile fits. Am I right?
Mhm. Yes. I appreciate you. Mm-hmm. So
Is there anything else I need to know? I'm not aware of it.
yeah,
Can you tell me a
uh,
bit more about
yeah,
it?
yeah. We'll discuss all about this. The simple febrile, as the name itself suggests, it's a simple one, not the complex one. Okay, so
Okay,
where actually you feel like you didn't understand, you can interrupt me.
okay, sure, doctor.
So simple means, as I said, it's a simple one. Febrile means fever. So some of the children actually they have a tendency when the fever comes, they throw it like a seizure. So that's basically called simple febrile convulsion, and that
Okay,
happens roughly between 5 months to 5 years of age.
okay,
And usually, what happens in simple febrile convulsion, that convulsion doesn't last not more than 4 minutes, 5 minutes.
okay,
And the convulsion actually doesn't come within 24 hours,
okay,
and it's a benign condition.
okay,
So that's
okay.
the reason actually consultant refused for the CT scan.
Okay, I got your point, but I would like to know that how we come to know whether it is simple febrile fits or it's because of some bug infection of the brain.
Yeah, it's a very good question. I appreciate you are this like you are working in a different direction, but at the same time, I just let you know, as I explained you, like if it is a bug infection, one thing the this conversion may prolong. One, second thing, the conversion may occur again and again.
Okay,
And in simple physical culture, there usually there is a family history. And a bug
okay,
infection, the child could have some more symptoms like in form of drowsy, coma, maybe actually he's having vomiting, nausea, maybe he's having a rash.
okay,
So in this case, CT is not required. The reason is this it's a benign condition. And there are two reasons why the CT is not required. As I said, it's a benign condition, does not require any investigation. And second thing, why the CT is not required. One is we are unnecessarily basically pouring the baby into the CT machine unless it's getting the radiations. When we know that the CT is not going to help in our treatment future.
okay,
And second thing, since actually the Samuel is just 18 months old. So in a city, as you know, we have to put this sample inside the machine, and that machine is not a procedure of like 1 minute or 2 minutes. It's a procedure of say half an hour or 40 minutes. Okay,
Okay.
so we have to give a
Mm,
sleep medicine. Sorry, this anesthesia also.
mm. So, doctor, I would like to know that in which all conditions, uh, I think we should be telling mom, we should be reassuring mom
Yes.
about that if this happen or if something
Yeah.
like that
Yeah.
happens, then you have to come back to us. So, can you tell me what all red flags we will be telling to the mother?
Yeah, yeah. This is very important question, Samuel. Oh, sorry, this Arthur. Can you please let me know what
Three
how much
minutes.
do you? Yeah, can you please let me know how much do you know about the red flags of this conversion?
Doctor, I don't know much because I'm posted in the department for last 3 weeks only.
Mm-hmm.
But I know that if it's associated with fever and if child becomes unconscious for a long time,
Yes, yes, yes.
then
Mhm.
that is bothering. And
Yeah. So
am I right?
yes, yes, yes. If the child is like having the fitting more than 5 minutes, as I explained you, he's having some. You feel like he's having some untoward sign and symptoms, like he's after the fit. Actually, he's still conscious. He's drowsy all the time, and he's having this some deficit in this neurological deficit. And then actually there's basically certain indication where we do the CT scan, and in that case actually we even don't talk to the mother or a father. We just go ahead. We want a CT scan because we want to make a diagnosis. We want to make a child to be treated.
Okay.
Okay. So
Okay.
Arthur, do you have any other questions or concerns?
Right now, I have these questions only, but if anything comes to my mind, can I get back to
Yes,
you?
yes, yes. Well, I will be very happy. I'll be very happy and applause you and I basically help you where actually is my this thing. Okay,
Okay.
Arthur, why don't you do one thing because you're so bright and brilliant student? So why don't you think you make a PowerPoint presentation of the simple prayer conversations? I'm going to help you.
Okay.
We can present in our next coming this education meet.
Okay. If you will help me, then definitely I'll be happy to go ahead with it.
How you like this idea?
Great. I think it's great.
Okay. And meanwhile, actually, I'm going to provide a good material of the simple page conversions. So I can go through and actually then we can meet another one more another time to discuss another things of that convergence also. Okay.
Okay.
So, Arthur, whatever actually we have our conversation, can you explain a little bit about this in a brief way?
Yes. So, doctor, we have discussed that about simple febrile convulsions which Samuel is having,
Mhm.
and we call it simple because it occurs between 5 months and 5 years of age. And usually there is one episode of seizure in first 24 hours, and the child is otherwise well, and
Yeah.
there is no rash.
Yeah.
Um,
And
am I right?
one more thing, Arthur, we have to explain to the parents, like whenever there is a fever comes, because fever is like a very common entity. And whenever fever comes, they are supposed to bring down the fever as early as possible, as soon as possible.
Time up. Time up.
Yes, sir. Thank you so much. We'll meet next time. And
Thank you,
wish you
doctor.
good luck for your exams.
Thank you.
He was extremely well from what I was a listener. It's okay, Dr. Manish. I give a feedback little bit.
Yes, yes, sure. You can give. Go ahead.
So you look so confident and very confident, well prepared for the exam. That was good. Your introduction was very good, and you told Arthur that you be a very good budding pediatrician. This is a very positive thinking
Mm.
sign, which you already told in the first thing. And then you asked him about his concerns, whether he knew about febrile seizure or no.
Mhm.
And then you told him from your side that what is a febrile seizure, and the conversion was going on it, and it was really really a very confident conversation. One a little bit of thing I felt is that some of your sentences were too long actually. So
Mhm.
just you can break up into two or three sentences. So
Okay.
after you said that what do you know about febrile seizure, then you said that it occurs in this. Instead of saying all the three four sentences at one go, you can
One
take a
go.
break. and tell him, yeah, Dr. Arthur. So, am I being clear to you, or is it something you want to add, or something you want? What do you know more about it? Just a little bit of break, because a continuous 3-4 sentence, and if the role player is not talking for a long time, it makes it monotonous. Your tone was good. Otherwise, your tone was, it was not, it was going up and down. It was very good. Up and down. You seemed confident, and it was a very free flowing conversation. Very free
Thank you.
flowing.
Thank
And
you so much.
all variables, all points were good. Just a little bit, your sentences were a bit long. Otherwise, there was nothing I can comment on. Quite good, Dr. Naresh. Well done.
Thank you so much. Thank you so much.